Hi, I'm Leoni from Run for Rhinos, and today I'm here with Dr. Emma Rambert from Vlakpan Animal Clinic to talk more about calf transport and also a clinical examination on them. Hi Emma, so you were a small animal vet in England. What made you decide to come to South Africa and work as a wildlife vet?
Okay, I had a small animal locum in Cape Town. I like to travel, and so I came over at the end of '99 for that small animal locum. And then I got involved with the wildlife and I never went back.
So you're still on holiday?
I'm still on a long holiday.
You performed surgeries on rhinos as well, and one case being at Wild Hearts. What happened, how did you handle it, and what was the challenges involved?
Okay, this was an interesting case. One of the main surgeries I've done is a patent urachus in a little rhino, and that's a condition that's seen in horses quite a bit, but obviously it's in the literature with the rhino. I had to do a lot of doctor googling to find the papers. So obviously a patent urachus is when the urine is the umbilicus hasn't closed properly and the urine is going out through the hole. Now that's something that can be seen in rhino babies through trauma of the umbilicus, and you can actually close it chemically with iodine on a lot of cases. So we do see that sometimes. In the case of Faf, who you're going to see, it was pouring out. So we gave him a couple of days, and then I realised I was going to have to do surgery on him. But the challenge there is that we don't have a nice surgical facility near here, so we've got to be as clean as possible, but we basically did it in the garden.
Most facilities aren't really available when doing surgeries on wildlife, and I know that you have done some in the field as well because you don't have any alternative. But to ask you about the calf transport, what is it different from the adult?
It actually depends. With the calf transport, it actually depends whether they've got a mum or not, because one of the biggest challenges for rhino that we have is their stress levels, and they're very prone to gastric ulcers. So it all depends on whether you're moving a stressed calf or a calf that's got its mum. So obviously a calf that's its mum's been poached or killed, or for whatever reason, it's going to be a more stressed calf. And if it's got its mum and it's going with its mum, that's not so stressed. So obviously we've got to decide how to tranquilise those calves en route. So it does depend. I change my mind according to the story involved to see whether it's been without its mum for 2 days, or it was with mum, or it didn't drink, or it was attacked by predators. So it all depends on what the story is, and I change the protocol according to that.
That really makes sense. What measures do you take when a calf is being transported to Wild Hearts?
I think what we do, and I work quite closely with Ensabet on that, we need to get the full story. I need a history before we decide. Very often that can be in another province, so I'll talk to the vet involved, and that's also very important to we need as much history as possible. So usually the network of wildlife vets in the country is quite close and we talk a lot, so it all depends on, I need to know what they're using on the dart. I want to know whether the animal had drips, because with a calf that's been stressed, we have two main challenges, is that the temperature and their glucose levels. So very often on site they may have a drip. We might not be that lucky, and sometimes when they get here they are quite compromised, but ideally they have the drip there, and then on capture then they come to us. So we also have very trained drivers to help that if it's not been escorted. So we want them dripped, we want to just check the tranquilizer, then as soon as they're here we again adapt to each calf, and also each calf has a different personality.
I would like to know, it's a sad but very happy day when the babies graduate from Wild Hearts. How do you take that on after they've been weaned, to move them, relocate them to a different place?
I think that's very difficult because you become attached to them, and we tend to put them together. And so, I mean, Ensabet particularly will work very hard to try and keep them together. So it all depends on whether they're owned, or because there's also private rhinos and there's also government-owned rhinos. So we've got to be very careful with how we keep them together, because even when they're weaned, they're probably at the most fragile when they are weaned and they move off, and they get even more stressed on the other side. So we've done that bit until 18 months, 2 years. And then there's a huge big risk when you move them to a new place. So we actually have to do a lot of investigation on where they're going. Do they have facilities to put them in a boma? Are there two? Because a rhino needs company, and that's probably what we've learnt a lot over the years since the poaching, since 2008 when the poaching increased. We've learnt a lot because we didn't have those challenges before, and now we do. And the more we learn about them, the more we realise that they're very sensitive and they need to be together.
Are the calves more sensitive to the medication than the adult, or is it more or less the same?
Okay, I would say that it depends again on why you're getting your calf. Are you getting it because the animal is compromised and has lost mum, or are you getting a healthy calf that's had mum's milk the day before? So yes, they can be because they're much smaller, and depending on whether it's white, excuse me, depending on whether it's white or black rhino, whites are very sensitive anyway. They do tend to have hypoxia. Particularly Professor Mayer has been working on all the aspects of the biochemistry and the physiology of that. Something that we do in the felt practically, but we don't know why we're doing it because it works. So we tend to have to use the drugs very carefully with the calf, and we use dregs of it, and the monitoring is very important as well when you get to it. So obviously yes, but we have to watch a little calf a little bit more.
Is hypercapnia also one of the side effects when transporting calves?
It is. When you dart the animal, then you do get all the hypoxia, hypercapnia, increased lactate levels, all the things that in the felt we might not have the right toys to detect that, but we do know from the literature what happens. So we just have to look at the animal, and we tend to reverse it slightly as well, so they don't travel under the darting, the original immobilizing drugs. So we do give them something en route as well. So usually then you know that they're right, and they have regular checks during the transport as well.
When doing an exam on a rhino, where do you usually start and what do you look for?
That is a very interesting question, because this isn't a dog or a cat or even a horse. So what we look at, first of all, you have a look at your animal, and it's a very thick-skinned animal, so it's not as easy to check certain parameters. So I always look at the rhino first before I do anything, and you look at the body condition. So as normal in any animal, you're looking at on this little one, you're looking at the back, the spine if it's protruding, your hip bones as well. So you just get an idea, because that's going to tell you what dose you're going to use. And also, again, most importantly, the history of the animal. So I always like to know what's happened to the animal. Why are we darting it? Are we just loading it? Or has it been in the boma for 3 months and maybe not eating properly? So all those things that can compromise an animal gives you an idea of what dart you're going to use. So it's, if you've got an animal, so we can't do a clinical exam before we anaesthetize. For the cat and dog, you can do a full clinical exam. We have to dart and then do the clinical exam. So obviously that's going to affect the actual animal as well, and we have to go with some risk. Any dart is a risk because you can't do a clinical exam. We can't anaesthetize a wild animal. We can't go up to it and have a listen to it with a stethoscope. So once the animal's down, we can do a couple of parameters depending on your budget and your toys. So you can have pulse oximeters that will get your oxygen levels. The one thing that I like to hear, because you can hear the breathing. So I feel very comfortable if I can hear respiration. So I don't have to actually feel it. Some people will feel here at the nose, but I can hear a rhino usually. So if I'm working on a rhino, I'm comfortable hearing a regular respiration. With the heart, yes, you can use a stethoscope, or you can actually just put your hand on there and you can actually literally feel the heart rate. And temperature. You've got to be careful when they're heat sensitive, so if you've overdone it, we're getting into summer now, the temperatures are getting high, so we've got to watch it when we're darting rhinos now. So temperature rectally.
After explaining the vital signs to us now, how would you measure skin elasticity in capillary refill time?
I wouldn't. No, sorry. No, I said essentially that is a clinical exam, and that's what you would do on everything. These aren't normal. I mean, you still can check colour, mucous membrane, so you'll have to look at, because this isn't skin. This is, I mean, it is skin, but it's very, very thick. I suppose this is very thin here and thin under the thighs, but I don't. You can tell the dehydration a lot more because the eyes are sunken. So I won't do skin tenting on a rhino. So I'll look at that, and again, history, has it drunk? And you can tell they get a little bit, you can see a compromised rhino, and you can just assume that they haven't had enough fluids from that. If they're mobilised, a more crude way of checking the oxygen levels is to go for your ear veins here and take in the colour. It sounds not, if you don't have your toys, this is what you'd do. Dark blood, not good. Red blood, good. So it's very simplified, and then you know when you get to the animal that you might have a compromised animal. Though I mean that just gives you a crude idea of oxygenation of the blood. So if you don't have your toys and you can just tick, and so dark blood will tend to say that the blood's not looking too good on the oxygen level. So you'd want to try and reverse with your butorphanol if you have oxygen as well. Both of those together have been proven that does help the oxygenation a lot better in a white rhino.
Is it cyanosis you are referring to as well?
You tend not to see it. You mean with the sort of more blue mucous membranes? I think the guys that have got if say at Honest Report they're doing surgery on these animals, they'll probably have all the right toys. With us in the felt, we tend not to have all of that, and you want to get your animal up as quickly as possible and safe and loaded. So you try not to have the procedures, too lengthy procedures. I mean, Faf was a different case. I think it took me 3 hours to do him and keep him down on the anaesthetic with a drip. So I was always worried with him, but I knew I had to do it, otherwise he was going to die. So I mean, he's coming up. I still think he's coming up to his year now. And then I said I'd feel a bit more comfortable after a year, so we're getting there with him.
Okay, so he has to undergo another surgery? No,
he's not. It's just me. It was such major surgery for him, and probably not in the most completely perfect conditions. So it was a bit of felt surgery, and I did as much as possible with the sterility and everything, but it's not in a theatre. So I was not happy for a while with him, and then I pretty much said after a year that I'll be happy, and we're getting up to that now.
Can you explain to us injection and darting sites that's ideal for a rhino?
Okay, you're dealing with a very thick-skinned pachyderm, so it's thick-skinned. So if you're from the chopper, you've got particular muscle areas that are the best to get the dart in. So you're looking at a 2-inch to 1.5 inch to 2-inch needle to get in. So if you think about rhinos as well, you think that they're completely covered, but these bones here on the foreleg as well are quite superficial, so you can actually feel the bone. So if you hit a bone, you've got no chance. The other thing is if they're not standing broadside, all these skin folds get in your way as well. So if you put a dart through there, nothing's going to happen. So you really want a nice straight one. Hump is nice. So you're looking at this triangle, that's nice. And butt, always good. A butt or a thigh. So you've just got to be careful of these superficial sort of humerus and femur as well, that you're going to, if you hip bone, the animal's not going to go down. From the chopper, I said, so this one is a good one, so your gluteals and then your lumbar area as well. So that will work. So that you've just got to get a good muscle. So if you're doing it from the ground and they're looking at you, that's very difficult, because they tend to, you've got to wait till they turn away so you can get a nice hump or leg, or when they're walking away from you or running away, depending on what they're like.
And the ejection sites?
Ejection site's pretty similar. So you again, the other thing with the dart site, you want to treat it as well. So it's a 2-inch needle that's going into the muscle. So we tend to put local antibiotics like a mastitis tube in the dart wound, because otherwise it can form abscesses. So we treat the wound as well. So with your injection sites, if for antibiotics, so muscular, intramuscular injections, again here and there, I pretty much do those. To get blood samples or to do IV injections, intravenous injections, this is nice. Ears, that's very superficial, and also you've got wonderful sort of leg veins as well, sort of down at the bottom here. So your carpal, I'm not going to say the right words actually, because I can't remember what they're called now.
Is it a cephalic vein?
No, that's just cephalic. This is like your medial carpal, I don't know the right word. but it's the vein there, you see? It's practicality, you forget all the real words, you see, after a few years in practice. But yeah, so with your veins, nice, if you're taking a lot of blood, you want it here. If you're just taking a little bit of blood for the DNA, because obviously every animal that's moved now must have its own DNA for the Rhodes system, which is the DNA department at the university.
What injuries do you often encounter in rhinos, barring poaching-related issues, self-inflicted, inflicted by other rhinos, or as a result of human handling?
Okay, what do I see the most of? Fighting injuries with bulls. So if they've got the horns, we're doing a lot of dehorning at the moment, but it doesn't mean that they can't injure the rhino. So we do get horn injuries that can be quite deep, so we tend to, and maggots as well. We're coming up to summer, so the flies tend to like to lay their eggs in these wounds, so we do get some horrific ones. Snare injuries, and it's anything that, I was going to say, we actually get trough injuries, so it depends if it's a semi-intensive situation, and sometimes they get the trough because they've been playing with the trough, so we've removed a few troughs from rhinos. And silly accidents, you know, if they've fallen into an old dam or something like that. So it tends to be superficial injuries. Obviously, bullet wounds, we're not talking about that at the moment. But fighting, so if they're under pressure, so if the guys that are doing the intensive farming, I would say there'll be a lot of interaction there as well. So you've got to watch the interaction because you're going to get injured rhinos.
Have you been involved in treating poaching victims? If so, can you give some examples? Was there a calf involved, and what are the first steps in approaching one of these situations?
That is a very complex question because yes, we've had the bullet wounds and we've treated them. Some of them are in an area where we can't do anything, but we try. Basically, if they keep breathing, we'll keep trying. If we've done post-mortems afterwards, then we realised that we weren't going to be able to do anything. So unfortunately we've got a massive animal, and if the bullet's inside, it's going to cause trouble. Sometimes they'll encapsulate and we can just forget about it and they carry on as normal, and they're found afterwards. But anything here, we start looking at abscesses and treating the bullet wounds. It all depends on where that bullet is, whether it's going to cause permanent damage. Because obviously the calves is a poaching victim as well. If you have a calf that's mum's died, it's a poaching victim. And people tend to, if they're looking at the stats, will just say the rhino that died. But that rhino that died probably was pregnant and has got a calf as well. So you've got a 3 in 1. So you get the trifecta there. So you've got 3 dead rhinos, usually, because we've still got to deal with a healthy baby but is very, very stressed. So that's where the work comes into it, is actually spending the time with these animals to try and make them feel better because they're very stressed. And so, as I said, if it's a female cow, most cows are, but if it's a female, you tend to lose more than just her. You tend to possibly lose 2 offspring at the same time.
Emma, thank you so much for taking the time and doing this interview. And we appreciate all of your time and dedication towards treating and helping the rhinos. And I would like to say that you inspire us as vet students, and we do appreciate in helping us to learn some of these anatomy and points that we need when we do go into rhinos, if we do go into rhinos or wildlife.
Well, it's a pleasure, and hopefully there'll be some rhinos left for you guys.
Oh. Thank you for watching, and if you have any comments or questions, please leave them in the comments box and then we will get back to you with answers.